Hello, everyone. Dr. Spencer here. Just wanted to do a quick overview of the week two case study. Just review it with you, just kind of break it down and just help with learning. You guys did a fantastic job. I've heard from the instructors in the other courses too that it was really nicely done. So I thought it would be nice. I discussed with some of your professors to just kind of break it down and talk about the case for you. So again, the case study involved Jane. She's a 32-year-old married female with a 1-year-old child who's contemplating returning to work as a paralegal. She presents to the office well-groomed, neatly dressed, but during the interview, she's noted to be fidgeting, making poor eye contact, reports that she's been feeling increasingly anxious when thinking about leaving the house for work each day. She worries day and night and feels her heart rate pounding at rest. She's having trouble sleeping, difficulty concentrating, feels fatigued, and her symptoms have worsened since the birth of her child. She's worried that this will affect her marriage and other relationships and will prevent her from being able to return to work. And she denies any substance use, denies being suicidal, homicidal, denies audible visual hallucinations, and no other known psychiatric history. So for the assessment, you were asked to provide some questions that you would ask, and you guys did a nice job on this. I want you to list out questions. It doesn't have to be an extensive list, but list out questions that you would ask, particularly as it's pertaining to the possible diagnosis, right? So um, we know that for this patient, there are certain things you want to find out to make sure that it is part of the diagnosis. So, do you feel anxious or tense much of the time? How long have you had these symptoms? If it's only been a week, right, then you know that it's probably not generalized anxiety disorder because that has to be for at least 6 months. So, does your family tell you that you are worry wart? Do you think you worry about things excessively or out of control? How long have you had these symptoms, as I shared? Any substance use or abuse, including marijuana. Many people don't think marijuana is a substance or an illegal substance. And ask about alcohol as well. Excessive caffeine intake. Any thoughts or plans to harm yourself or harm someone else? And have you sought treatment before? Very good questions to ask. I took this from your book, The First Interview, that you should have for clinical. It does list out disorders and gives you some suggested questions. And again, these aren't comprehensive, but you want to come up with some good questions that you'd want to ask a patient with a particular diagnosis. And you guys did a nice job on this. Objective findings, you would have their vital signs. Physical exam we don't typically do in psychiatry, but you would note their arms. Do they have scars or arms on their legs from cutting, or are they pulling their hair or picking at their skin? I've seen that a lot. Are they restless, wringing their hands, legs, moving, not stopping, fidgety? Laboratory data, if you have this prior to, or you could even obtain this, would be a TSH, a CBC, CMP, UDS, EKG, or other diagnostic data you might have done prior to or as part of your assessment. Some screening tools, again, your PHQ-9, HAM-D, GAD-7, Beck inventory, and mood disorders questionnaire. I was glad to see a lot of you incorporated that into your possible screening tools. So some differential diagnoses. Again, you were to provide two and then finalize your diagnosis. So good job on that. Remember your medical conditions too that could possibly present as some of these psychiatric disorders. So, panic disorder, social anxiety disorder, you have hyperthyroidism, phenochromocystoma, COPD, transient ischemic attack, epilepsy, bipolar disorder. It's a possibility, right? Use or abuse of caffeine, decongestions, albuterol, substance use disorder. Um, then our diagnosis that we nailed down was generalized anxiety disorder. Again, that she had excessive anxiety or worry greater than 6 months, difficulty controlling her worry, and it was associated with these symptoms below, three or more of the symptoms below. Remember, she was restless, easily fatigued. She had trouble concentrating. She was difficulty sleeping, and it was causing her distress and in her social life and other areas, and it wasn't attributable to any other physical causes. Oh, and don't be afraid to, actually don't. I want you to use your DSM-5 to help with these diagnoses. That's It's great that you're using other articles too to back up your diagnosis, but go with your DSM-5. That's what it's there for. Treatment. So there are two main treatments for generalized anxiety disorder. That's cognitive behavioral therapy and medications. And patients can benefit the most from a combination of the two. Either can work, but we know that patients do better when there's a combination of both therapy and medications. Treatment, cognitive behavioral therapy. This includes psychoeducation. I always try to provide my new clients or clients who are having anxiety with some handouts on grounding techniques, on meditation, on deep breathing. Those can be very helpful. And then when they're working with a therapist or counselor, working on changing maladaptive thoughts, maybe possible gradual exposure to anxiety provoking situations. And then medications. We know that our SSRIs and SNRIs are first line with to treat this disorder. And so write out your medications. And many of you did a good job with this. Write out your medication that you want to. I want you to be the provider. You're the practitioner here. So Lexapro, 10 milligrams daily. And then what are the side effects, inducers that you need to be aware of, inhibitors. So don't take with alcohol, can cause QT prolongation with macrolides such as azithromycin. So avoid use. It can cause nausea, dry mouth, dizziness. Always warn patients about the possible um, or worsening suicidal ideation when taking this medication. Avoid MAOIs, OTC herbal supplements, aspirin, NSAIDs, clopidogrel, warfarin can cause bleeding, and avoid other drug class medications, such as an SSRI or SNRI, as this could cause serotonin syndrome. And then some additional medications that you could use is hydroxyzine, 25 milligrams twice a day as needed for anxiety. And I always tell patients this can make you sleepy, so just be mindful of that. And then buspirone, 5 milligrams twice a day, can take 2 to 3 weeks to reach full effect. Titrate this slowly. I use this one a lot, and I've had pretty good effect with my patients. And then you want to have them follow up in 1 month or sooner if symptoms worsen. And then call 988 or go to the nearest emergency room if they experience suicidal thoughts. And that's it. Again, great job, everyone. I was really pleased to see everyone's responses and interaction. Looking forward to great things from you in the future. And we're going to try and do these weekly. If you have any other thoughts, please let us know. But we're going to try to review the case studies every week for you. Take care. Have a great week.